The Ebola outbreak in West Africa is a formidable public health crisis which threatens to reverse development and peace-building gains in the most affected countries and in the region. The World Health Organization has reported nearly 5,000 cases and more than 2,800 deaths. Difficulties in monitoring and reporting the outbreak have meant that the total number of both cases and deaths is likely to be higher. International experts assess that Ebola is spreading at an exponential rate, with the number of cases now doubling approximately every 3 weeks. This deadly disease is affecting some of the world's poorest and most vulnerable countries, all of which need international support to fight it. The most severely affected countries, Guinea, Sierra Leone and Liberia, have very weak health systems, lacking human and infrastructure resources, having only relatively recently emerged from long periods of conflict and instability. This unprecedented Ebola outbreak requires a response with the scope, the scale and the speed necessary for this complex emergency, with all its political, social, economic and security dimensions. The newly created UN Mission for Ebola Emergency Response marks the very first time the UN has created a mission for a public health emergency. It will bring together all the assets of the UN and work closely with the governments in Guinea, Liberia and Sierra Leone. Now is the time for the international community to come together to stop this epidemic and save countless thousands of lives.